Hello everyone, my name's Alex and I'm another one of the Camden and Islington team. I'm really pleased to be here to speak with you today, and what I'd like to share is the findings of a needs assessment that I did across both boroughs looking at the problem of food poverty. So a quick introduction to the topic, because I didn't know much about it when I started out. It's a problem that is really hard to define and even harder to measure. So there are many definitions, but the one that I used for my work is, as you can see here, from the Faculty of Public Health in 2005, talking about the inability to afford or have access to food to make up a healthy diet. So as you can see, a very broad definition which touches on lots of different things. Another key thing about food poverty is that it exists on a really broad spectrum of food insecurity, from worrying about your ability to put meals on the table for your family, right through to severe crisis level hunger with food insecurity. And the thing that's really key about this scale is that there can be really severe health impacts for people experiencing this at all points along the scale. And they range across the life course, really. So both children and the elderly are vulnerable. And the consequences range from hunger and underweight, which perhaps are the things that I imagined about food poverty, but also to overweight and obesity, to diet-related diseases, including diabetes and cancer. And a really significant factor for people experiencing this problem is social exclusion, feelings of shame and stigma, and some of the mental health consequences inherent in this problem. So thinking about what causes food poverty, there are many different causes, and some of the common groups of causes are up here. So very relevant to today's session really are the financial causes, thinking about low income, debt and unemployment, and that really undercuts all of this. But there are other very important factors, such as poor access to affordable healthy food. So if you live in an unhealthy food environment, that can be problematic in terms of your food security. Lack of confidence or skills in cooking and budgeting is also key, and there are many, many others, such as mental health, lack of facilities to store or cook food. So if you live in a hostel, you can't have an adequate diet because you haven't got facilities to cook or store. As you can see, the causes are complex and they interrelate very strongly. And really, as I say, income and poverty undercuts all of these. So food poverty really is a problem which highlights health inequalities in the population. So I'd like to move, oh no, hang on. So this is national data from the Trussell Trust looking at referrals to food bank and the reason for those. So we're talking about the severe end of that spectrum. And if you look at the left-hand side of the graph, you can see that really overwhelmingly the most common causes for crisis level hunger are the financial causes of low income and other forms of poverty. So as I say, that undercuts the whole picture of this. So thinking about our local findings, as I said, it's a hard problem to measure. There's no routine data collection. So what we did was used a number of different sources and applied some secondary data source estimates to our population. So one of the headline figures for me was that there are over 40,000 people in Camden and Islington, experiencing moderate to high food insecurity. And if we nip back to our spectrum, that means experiences from compromising on the quality of your food right through to experiencing hunger. Looking at the lower bit there, we did engage with quite a number of people from all sorts of different services to start to map out our services and where the gaps were. And I was astonished that 87% of those respondents encounter food poverty routinely, even though almost none of them worked in services set up to deal with food poverty. Many of those professionals felt that food poverty was increasing, and that is reflected in the line above that in the food bank referrals, which were rising in number, which mirrors both London regional and national data. So I'd like to move on to some of the qualitative evidence, because for me that was some of the most powerful evidence that emerged from the process of the needs assessment. So I conducted qualitative interviews with both residents and key workers, and I'll share some of the findings from those with you now. So the first thing that we wanted to look at was the experience of food poverty. What are people in Camden and Islington experiencing in this? Found quite a high level of experience of this with a big range. Some people were describing long-term experiences of food insecurity, as you can see from the top quote here with our interviewee who was on benefits, and their experience was a feeling of you just have to manage, and if you can't, you'll go without. Some of the residents described really profound experiences of severe crisis level hunger, such as the second quote with a resident describing that she and her son shared a bowl of soup and would have half one day and half the next because they didn't know where the meal the next day would be coming from. And again, undercutting all of this was that people who had experience of food poverty had really profound experiences of social isolation and exclusion as a result of this. So the interviewee with the bottom quote was describing her feelings of total inability to shop in certain supermarkets, in this particular case Marks and Spencer, because of her perception that other people in the shop would see her and feel that she shouldn't be in there. We next thought about what were the reasons that people were experiencing food poverty, and true to form, there were an enormous range of reasons disclosed to us. By far the most common of those reasons were financial poverty, low income reasons, such as the first quote here with somebody telling us that obviously the money I'm on from benefits doesn't stretch to cover enough food. That was something we heard again and again through all the interviews. However, people did also talk about problems with accessibility of affordable healthy food, such as in the second quote, with somebody telling us that they couldn't afford food from any of the supermarkets in their area because they were smaller shops, which tend to be more expensive particularly for healthier food like fruit and vegetables. Again, as I said earlier, often the causes interrelate, and I think that mental health problems is a really stark example of that, illustrated in quote number 3. This interviewee was experiencing mental health problems as well as benefits issues and existing on a very low income for a prolonged period of time. And she describes about experiencing mental health issues worsening her food poverty by decreasing her motivation to eat well or be able to cook, so she would just eat the wrong food to stop the hunger pains or just drink milk. We wanted to think about which groups in the population were most vulnerable to food poverty. So these green bubbles are now interviews from the key workers that we spoke with. Again, poverty and low income was the factor that was mentioned most commonly by our interviewees. So the top quote here is a good example of that. Somebody saying, this is a council employee, saying it's pretty grim living on benefits, you just have no money, and that's the reality. They highlighted a number of different vulnerable groups in the population, and really there were so many that it was quite overwhelming. Children, the elderly, certain black and minority ethnic communities, although which ones varied across all the interviewees. But this second quote here really hurt me to hear it. This was the manager of a bench playground in Islington, describing how some of the children would ask to take a candle home because there's no light in the house, because there's no money for the meter. And a very good point from her that definitely no fuel for cooking in that case. As a result of there being so many vulnerable groups identified by the different interviewees, many of them emphasised that food poverty could affect anyone, and that's why universal services, which can be accessed by everyone, are really important. I'm going to skip a slide because I've been given a time warning. I just wanted to give you an example of one of the other ways we looked at the relationship between potential food poverty and deprivation, and that was through mapping using QGIS methods. So this is a map of Islington, and the dark blue shading in the background is looking at the local deprivation levels. So it's a local comparison, and the dark blue areas are the most deprived. The red and the yellow dots there are large supermarkets and discount supermarkets, which we were using as a proxy of places that you could buy affordable, healthy food. And you can see in parts of the map there, particularly the north and the east, that there are some quite big areas of the borough with really high deprivation levels, which are quite a long way from the supermarkets. And as one of our interviewees told us before, the smaller local supermarkets have been shown by research to be more expensive for healthy food. So this is an indication of a relatively unhealthy food environment in some deprived areas, which is likely to worsen the risk of food poverty. Both the residents and the professionals told us about barriers to accessing services, which again were widespread but most pronounced in the most deprived groups in society. And from all of the people that we spoke with, there were a number of changes that all of them were keen to suggest for how we could improve our local services. I've highlighted two there that I think speak particularly to the deprivation and poverty aspects of this problem, which are raising awareness of existing services, which was relatively poor amongst staff as well as among residents, which is obviously difficult in terms of encouraging people to access those, and minimising the barriers to access, which I'm sure you can imagine, are many and complex. So in conclusion, it's a vital public health issue, food poverty, and we know that many residents in Camden and Islington are affected by this. The causes of food poverty are complex and they interact with each other, but the most common ones throughout all of the work turned out to be financial and low income, reflecting that national data you saw on food bank referrals. There are many vulnerable groups. Again, those living in poverty are the most vulnerable across all of those measures. The barriers to accessing services tend to widen those inequalities, which is why we need a whole system approach to try to tackle this. I haven't had time to share with you the examples of excellent practice that exist in both boroughs, but there are obviously challenges, particularly in the current funding climate. And our next steps are that in both boroughs, we're now developing these findings into a food poverty action plan to start to tackle the problem. So thank you very much.
It's great to see such a nice combination of the individual and population level data. Is there any questions of clarification from the...
Thank you. It's really interesting. Just a quick one about the location of the supermarkets. So the bigger supermarkets and the cheaper shops tend to be in the less deprived areas. Any thoughts why? Is that a planning issue, or is that just where the supermarkets choose to go? Or what's that
I don't know the answer to that, I'm afraid. I agree it would be really interesting. But the way that I did this map was literally to Google the 7 biggest supermarkets and plot the locations of each of them and then rank them on how big they were in terms of using it. As with all of this work, it has limitations because we don't have good routine data, but we felt it was a measure that we could start with. So I'm afraid I can't answer the question, but I agree it's an important one.
Okay, I think we'll move on to the last talk. Thank you very much. So the final talk, we have Lorraine Hansford from the University of Exeter and Karen Coombs from the University of Plymouth. And they're both going to be talking about medicalisation of mental distress in low-income countries.